Hey everybody, this is Dr. Chris Kelsch from Avondale Health Center in Avondale, Arizona. Today I just want to talk briefly about a type of syndrome that does affect knees, and it's going to be called patellofemoral pain syndrome. Another term for it sometimes has been called jumper's knee. But what this basically condition is if you've ever felt your kneecaps pop or crack, you may have this syndrome. So what happens is you might get some of this popping and cracking. If we look at the anatomy of the knee here, this is the kneecap, this is the tendon that it sits in. And so every time you move your knee, there's actually a little groove back here that this kneecap will slide in. And sometimes what happens, there's a muscular imbalance in the muscles that surround it. And when that happens, every time you bend and move, this kneecap will deviate to one side or the other and it won't slide in the groove, and you'll feel it crack or you'll feel it pop. Now, long term, what it can do is cause pain and inflammation in the joint. If we go to a website here, this is Wikipedia, and I encourage you to go there if you want to read more about it. It just gives a description of what it is. I basically told you what it is. And if we kind of go down here, one of the things that can happen, it can result in thinning and softening of the cartilage behind the knee. We call that chondromalacia. Now that can be very painful, and you'll see that in kids that are young, or it's more common as a person does get older. Um, there's certain things that you need to make sure and differentiate. You want to make sure that they don't have tendonitis or bursitis. And we check for all those things in the clinic here. We do diagnostic ultrasound to determine the exact cause of the problem, and also an x-ray. Now, one of the things that makes females more likely to have it is something called a Q angle. A Q angle is the angle of the femur, the hip here, to the knee. If you compare that female to male, females have a bigger angle. So because of that, they tend to have more knee injuries because there's more stress put on the joints here. So any knee problem is more common in female, but of course males can get all these same things. So if you go back to the Wikipedia page here, one of the things it talks about is, we're talking about treatment here, is exercises. There's certain exercises that we know are effective in helping the knee. So working with the hip on the abductors and external rotation helps, as well as hip flexion and hip extension. Things like doing balance board, wobble board are also helpful as well. I'm going to show you some of the exercises that we would do from a rehabilitation standpoint shortly after this. One of the most effective things for patellofemoral tracking disorder or syndrome is rest. Simply resting can provide a lot of relief and help with the inflammation and swelling in the knee. Ice and medication has been very helpful. Ice, you're going to want to do about 20 minutes at a time, at least 40 minutes to an hour in between each one of those sessions. Doing different knee braces has been very helpful. We have some really awesome knee braces here depending on the severity of the issue. And taping, we do kinesio tape or strapping in here, and we treat knees very successfully on a conservative level. Now, in some issues, or some instances, I want to say, the problem is so bad that things like an injection into the surrounding musculature can be very helpful to help with the swelling and inflammation. If we were to do that with you, we would do likely an ultrasound guided one so that we know exactly where that medicine is going. So if we're going to go into exercises here, we're going to pull up this right here. One of the ones that we would do would be like an active range of motion stance on one leg on like a piece of foam, or you can do like a wobble board if you've ever seen those. Basically, you're standing on a surface that is a little uneven, so it makes you have to work a little harder to stand. So you're going to stand there on the one leg and you're going to lift the one leg up just like that. Do about 5 sets for about a minute, about one time a day. You can always up it as you are able to do more. If we go down to another one here, this is a resisted knee extension while you are standing with an elastic band. So what you do is you hook an elastic band right onto the leg here, and you are going to basically stand. You're going to hook it on right above the thigh. Going to perform about 2 sets of 10 repetitions about once every other day. Once again, as you get more comfortable and stronger, you can up it and proceed to more exercises. These are just a couple exercises. There's definitely a lot more to do. This type of syndrome, if you don't treat it correctly, will ultimately lead to knee arthritis or other more potential problems. So it's important that you diagnose it correctly. Here at Avondale Health Center, we see these problems every day. And so we are very good at treating these conditions. I'm going to throw a little video demonstration of how these exercises are done right now for you to get a visual. And then after this, there is an offer for a free consultation to our clinic. If you think you might have this problem, or if your knees are bothering you in general and you think you just don't know what's going on with it, take advantage of our free consultation offer. You can come into our clinic, and on that visit, we'll take a look at you, ask you a few questions, get a couple extras of the area, and we'll check your insurance out for you if you have, and then we'll give you a course of recommendations. Thanks for watching.